place that bill on call. I think I saw Senator Allen.
Yeah, thank you, Mr. Chair. Thank you, members.
Thank you. Senator Allen? We do have support on both sides, no known opposition. If we can just make testimony quick, please.
Yes.
Please proceed.
Thank you so much, Mr. Chair and members of the committee. This bill is SB 613 that has to do with updating the physician's guidelines for Alzheimer's care. I come to this experience and this issue as the grandson of someone who suffered from Alzheimer's and whose mother does a lot of crossword puzzles to stave off any possibility of getting Alzheimer's. So, but it's certainly something that I care a great deal about. And when I first came to this office, I reached out to Senator Liu and the Senate Select Committee on Aging and Long-Term Care, and they connected me up with some of these wonderful folks you're going to be hearing from today who care a great deal about Alzheimer's. And we kind of formulated the idea of this legislation, which includes creating management care guidelines for Alzheimer's and dementia. So it's estimated that today 590,000 Californians have Alzheimer's disease. This is a complex and costly disease. It rages in its victims for about 7 to 10 years. There is no known cure. 7 years ago, the Department of Public Health released guidelines that have helped physicians and patients across the country. These guidelines equipped our primary care physicians with up-to-date patient information and resources to better serve patients with Alzheimer's. This legislation that I propose today would just simply help to update the guidelines to take into account major changes in our healthcare system, the Affordable Care Act, changes to Medi-Cal, et cetera. So thank you for your attention. I just want to turn first to our very first witness in support, my constituent, Gary Bricker.
Thank you.
Yes, hi. Good afternoon, Chairman Hernandez and committee members. My name is Gary Bricker. I live in Senator Allen's district in Redondo Beach with my wife, Lisa. In 2012, at the age of 63, I was diagnosed with mild cognitive impairment and early onset Alzheimer's disease. I want to talk to you today a little bit about the avoidable frustration people like me in the current healthcare system and why we need a statewide guideline for physicians. I used to be a highly functioning person. I went to McGeorge School of Law right here in Sacramento. And although I was running a joint venture, real estate joint venture between a financial institution, Sacramento Savings and Loan that was on 5th and L, if any of you were here at that, and a couple of different regional real estate companies. And I did that during the day while going to law school in the evening. Even though I was working full-time, I graduated in the top 25% of my class. Yet now Alzheimer's has robbed me of my ability to work, and I was fired from 2 jobs in real estate companies within 3 years for performance issues caused by my memory loss. My most recent job was corporate real estate counsel for a company headquartered in California with locations in 42 states and 28 countries. As a real estate attorney, I was challenged to do the complex tasks that used to be routine for me. For 8 years, I tried to get answers from a series of doctors and specialists. They were well-intentioned but uninformed on Alzheimer's disease. My wife and I spent much time and money going to medical appointments that produced no results. Finally, when a doctor gave me my diagnosis, he told me that I couldn't work any longer and to apply for disability, and otherwise to come back in 4 months. This was not what I needed to hear, and it didn't help my wife or me cope with the diagnosis or give us any resources. There began an independent hunt for information and resources and referrals that my doctor could easily have provided if only he had a guideline like the one you're considering here today. I believe that this bill will not only help the care management of Alzheimer's, it will also have an impact on the diagnosis as well. With Alzheimer's disease, time matters. I'm asking you to support SB 613 with your aye vote, because good Alzheimer's disease management buys people like me with critical time. If my wife and I had been referred immediately to a support group, like a free support group offered by the Alzheimer's Association, right away, we would have found answers to our questions and much needed emotional support. Instead, we were cast adrift by the medical profession. I want to close by thanking Senator Allen for carrying this bill. It takes courage to tackle a topic that even doctors want to avoid. We just saw national data that 46% of people who meet the criteria for Alzheimer's disease were not told of their diagnosis by their doctor. This is compared to 92% of cancer patients. We are told as individuals and families and as a state, how can we make progress when half the target population is uninformed? It starts with physician education, and SB 613 gets us there. I can't change my diagnosis, but you can help other families avoid the frustration and confusion my wife, Lisa, and I experienced if you vote for SB 630.
Thank you.
Thank you for listening to my testimony.
Thank you. Anyone else in support? We have a little over just a minute, just less than a minute. Please proceed.
Hi, I'm Susan DeMorris. On behalf of the Alzheimer's Association, we're proud to sponsor this bill, and thank you, Senator Allen.
Any questions, any opposition to the measure?
Move the bill.
We have a motion to move the bill by Senator Mitchell. Any questions or comments? Seeing no questions or comments, we have a motion. Would you like to close?
I just respectfully ask for an aye vote. Thank you, Mr. Chair.
This is SB 613, due pass to appropriations. Call the members.
Hernandez?
Aye.
Hernandez, aye. Wen?
Aye.
Wen, aye. Hall? Mitchell?
Aye.
Mitchell, aye. Monning? Monning, aye. Nielsen? Nielsen, aye. Pan? Roth? Wolk? Wolk, aye.
That currently has 6. That bill has enough. We're going to put that bill on call.
Thank you so much, Mr. Chair. Thank you, Senators.
Senator Mitchell, would you like to go ahead and present your bill? Yeah, because Senator Mitchell has some individuals that have to leave, catch a flight, and then we'll definitely finish with you next. And which item did you want to do?
I'll only take up one, the time pressure one, and that's SB 402.
Okay, that's item number 11, SB 402, pupil health vision examinations. Please proceed.
Thank you. I want to appreciate Senator Bates and the committee for accommodating. I appreciate this is a deadline hearing. I have witnesses who need to catch planes. This is a bill that should sound familiar to many of you on this committee. It was before you a number of years ago. SB 402 will require students entering elementary schools to get a comprehensive eye exam by a physician optometrist or ophthalmologist. This bill also clarifies that comprehensive vision exams should include critical evaluations that can catch serious eye problems in students. Studies show that impaired vision in children can affect cognitive, emotional, neurological, and physical development. Students with impaired vision may experience developmental delays and lower educational attainment. In 2011, almost 40% of students tested at LAUSD experienced significant discomfort while reading or trying to study. In my district alone, in one elementary school, the Tom Bradley Elementary School in Leimert Park, 56% of the students experience binocular eye health problems. These are eye problems in children directly correlated with low reading fluency. Under existing law, in-school vision screenings only test school children for near and farsightedness, color blindness, and any noticeable abnormalities. This bill will ensure that we test children for 11 more conditions that can pose a challenge to a student's experience in the classroom. Conditions such as astigmatism, convergence problems, also known as the ability to move the eyes inward to focus, binocular vision, which is how well the eyes track and work together, accommodation issues, the ability to focus on objects at a distance, to name a few. Detecting vision problems early through more comprehensive exams will ensure that every child has the same opportunity and potential to learn. We have been meeting with stakeholders on this bill. It was double referred since we were heard in Education Committee, Kaiser Permanente, CMA, the California Nurses Organization. We appreciate the time they've spent in working with my staff. We have meetings scheduled, me personally, coming up for next week, and we'll continue to work with these organizations as we approach Senate appropriations. Let me also say that amendments that clarify what evaluation should be included as part of a comprehensive vision exam, the definition, the amendments are in mock-up form and should be distributed to, you should have them in your possession, great. I'd also like to inform the committee that we accepted amendments in Senate Education which prohibit the school from taking adverse actions against the parents or child for failing to obtain an examination, and which also retain the school vision screenings for children who are not able to obtain a comprehensive examination. These amendments are reflected in the most recently amended version of the bill, which is what you should have in front of you. I have several witnesses here who will testify in support of the bill. I ask your favorable consideration.
Thank you. We're asking the proponents limit their testimony to 6 minutes. Please proceed.
Good afternoon, honorable senators. My name is Dr. Glenn Kawaguchi. I practice in Ventura, California. I'm also a member of the California State Board of Optometry. Thank you for the opportunity to speak to you about this. One of the core responsibilities of the Board of Optometry is to protect all the consumers in our great state. The entire board does support SB 402 as necessary. According to a study published in Human Physiology and Mechanisms of Disease in 1996, 80% of a child's learning is visual. According to the National Institute of Health, 42% of preschoolers assessed through a comprehensive eye exam performed by an eye care professional had significant eye or vision problems. According to the Centers for Disease Control and the Prevention Fact Sheet on Vision Loss, our current educational codes as it relates to vision screenings are marginal, as 33% of children that pass vision screenings have a significant visual binocular eye health problem. The bill brought before you seeks to maintain the current vision screening process that is in place, namely vision screenings by pediatricians and school nurses. These individuals, along with parents and teachers, are critical in ensuring that no child falls behind because of vision impairment. The bill does seek to greatly narrow the gap for those 1/3 or 33% of children that are slipping through the cracks through a comprehensive eye exam to be conducted by an optometrist or physician. As an optometrist each week, I see several children that are slipping through the cracks, and it just breaks my heart. As a parent, I believe that even one child not doing well in school because of visual impairment is just one too many. I urge you to give SB 402 your aye vote. Thank you.
Good afternoon, and thank you, Honorable Chair Hernandez and Senators, for this great opportunity. My name is Dr. Christy Mitchell Remick-Weltman, and I am an associate professor and director of community outreach at Western University of Health Sciences College of Optometry in Pomona, California. I'm also author of the book Eyes on Track, A Missing Link to Successful Learning, as well as numerous scholarly articles on children's vision. I supervise the vision screening program for the Pomona Unified School District and have done extensive research on the importance of early comprehensive eye exams for children in various positions I have held. The current vision screening system is failing our children. We can and should do better. I became passionate about highlighting the strong need for comprehensive eye exams for children from my experience working at a vision clinic located inside the San Bernardino County Juvenile Hall early in my career. I was on staff as a doctor of optometry, and we had an eye exam area set up in one of the cells. I worked with a psychologist and other members of our multidisciplinary team and provided comprehensive eye examinations and glasses for the inmates. Many lives were changed for the better because their vision was improved. There was a pattern of vision problems that we found in the juvenile delinquents that had never been picked up by vision screenings in their life. Children with undetected vision and eye health problems often have trouble with their schoolwork. We know this. We know children's vision and eye health problems are silent. Children do not complain about their vision because they do not know what normal vision really looks like. The vision screening model presently in place has traditionally checked the child's distance visual acuity in the right and left eye using a Snellen eye chart at 20 feet, and this chart was invented during the Civil War to test soldiers' vision on the battlefield. This screening model misses many children with significant eye or vision problems. The state should require children to have a comprehensive eye exam performed by an eye care professional considering a child's vision that includes their eye teaming and eye health. This is essential to their ability to read and to ultimately learn and succeed in school and in life. The Affordable Care Act recognizes children's eye care as one of 10 essential benefits. Thus, all health plans are required to cover the full cost of a comprehensive eye exam and glasses for children. Therefore, cost is finally not an issue, and this is good news for California. SB 402 ensures that all California's children can actually see the board in class, learn to read without the words on the page appearing blurry and moving, have both eyes working together when solving a math equation, and ultimately achieve academic success. Children that succeed at school have been proven to commit less crime and have improved self-esteem, and this is what we want for California's children. I respectfully request your aye vote on SB 402.
Thank you. Anyone else in support, just state your name and position only, please. Thank you.
Jasmine Gordon on behalf of the California Black Health Network in support.
Mona Maggio, Executive Officer of the California State Board of Optometry. We're the sponsor of the bill, and we are in support.
Kara Corches on behalf of the California Optometric Association, and we are in support.
Carrie Sanders with the California Pan-Ethnic Health Network, also in support.
Kendra Harris with the California Federation of Teachers in support.
Thank you. Anyone else in opposition?
Thank you, Mr. Chair and members. Teresa Stark on behalf of Kaiser Permanente. We do want to thank the author and her sponsors for having numerous conversations with us. And as Senator Mitchell said, we do have a meeting planned in the next couple of weeks with some of our eye health providers to talk a little bit more about the bill and our concerns with the bill. Our eye health providers have some concerns with mandating such a significant eye exam for all children. We certainly sympathize with the problem. It's absolutely not okay for children with vision problems to not be identified and diagnosed and referred to the appropriate treatment and care. So we absolutely want to assist the senator in achieving that goal. Vision screening and eye health science and literature is very, very complex. And so we just caution moving forward on such a significant mandate when there is disagreement in the eye health community about the best way to identify these children. But we look forward to working with the senator and her sponsors. Thank you.
Thank you. Anyone else? State your name, position.
Jody Hicks on behalf of the California Academy of Family Physicians as well as the California Academy of Eye Physicians and Surgeons. Just want to echo my colleagues' statements. We are not at a place of removing our opposition today, but we are looking forward to continuing the conversations with the senator and appreciate that she has taken the time to schedule some meetings with us and keep those conversations moving. And we support the intent of this bill, obviously, and look forward to finding a place where we can not be in opposition. Thank you.
Lydia Bourne, representing California school nurses as well as the American Academy of Pediatrics. Obviously, both nurses and physicians are always in support of making sure that children are healthy, particularly with vision services. At this point, we are still opposed. However, we've not seen the mock-up, so we would like to take a look at those to see if we are in agreement. But at this point in time, we still are opposed. And we are looking forward to the meeting that is due in a couple of weeks, and thank the author as well as the sponsors for the willingness to work with us on this issue.
Thank you. Questions, comments from any of the members?
I just have a comment.
Senator Nguyen.
Senator Mitchell, I just want to thank you for bringing this forward. I've been a issue that it's been dear to my heart, trying to get all the children in schools to be able to make sure that they know that not seeing clearly is not normal. And, you know, because a lot of the children who don't want to wear glasses or actually not knowing ends up always in the back of the classroom, and they end up not doing well in school, and that's the start of their life, and we don't want that. You know, so I will be supporting this today, but also hearing though there are some concerns in terms of, because I'm not an expert in what should be examined, what shouldn't be examined, how comprehensive it should be. So I thank you for making an effort to work with the opposition, and so that we can get to the right place, because this is the right thing to do. Thank you.
Thank you, ma'am.
Any other comments? Is there a motion? Moved by Senator Wolk. I'll just make a comment. Appreciate you moving the issue forward. There are school screenings in the state of California as a mandate. I believe it's kindergarten, first grade, third, eighth, ninth grade. It plays a critical role in screening, but more in particular in picking up deficiencies in vision. But it does miss quite a few conditions of the eye. And it does predominantly check for distance, but even at distance, even if you see 20/20, if somebody is very farsighted, could miss a lot of problems with reading, a lot of close work, and the ability for one's eyes to work together. So I am supportive of it, and would you like to close?
Given the comments of the chair and given your professional expertise, I ask for an aye vote, because Dr. Ed said so.
Thank you very much, Senator. Item number 11, SB 402, do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen.
Aye.
Nguyen, aye. Hall. Mitchell.
Aye.
Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Wolk. Wolk, aye.
Currently at 6, enough to get out. We're going to place that bill on call, and thank you.
Thank you. Appreciate.
Senator Bates, I appreciate you allowing Senator Mitchell to go first. She had some individuals that had to catch a flight. If you can please come up. And one quick announcement, item number 16, SB 514, has been pulled from the calendar. We are at item number 24, SB 787, Bates. Senator Bates, would you like to stand or want to sit? Yeah.